I think that's an important point you make. Your hearing loss is ever present.
It
doesn't matter where you're at. It accompanies you. It is you.
And if you're taking them out, putting them in, taking them out, putting them in, your brain has to relearn how to use that signal every single time, right? It's not like glasses.
Welcome to the Ask an Audiologist podcast, real audiology white papers written by real audiologists and explained to you by a real audiologist and a guy who isn't. Now, here are your hosts, Dr. Michael Squires and Kevin Ziener.
If you didn't get your mother a gift yesterday, A, shame on you, and B, there's still time to make it up to her by giving her the gift of a brand new episode of Ask an Audiologist. I'm your host, Kevin Ziener.
I'm Dr. Michael Squires.
Dr. Michael Squires, it's also May, which means it's
Better Hearing and Speech Month.
That's absolutely
You
correct.
could also give your mother the gift of better hearing for May.
By sending her to Dr. Michael.
Well, or any other audiologist that's
assuming you don't live in West Virginia.
Somewhere closer to you, probably.
Yeah, that's fair. But today we will be discussing a topic I'm sure every single audiologist in the world has had to deal with at some point, and it's the question, why aren't my hearing aids working? The article was written by a familiar face from Beaufort, South Carolina, our friend Dr. Meg Kalady of Kalady Audiology. So, Dr. Michael, before we get into it, did you make your mother feel special yesterday?
My mom is special.
Yep.
So anything I can do to make her feel special.
Did you make your wife feel special yesterday?
Oh, yeah.
Did you make sure that the kids made her
feel special?
Yeah, exactly.
That's honestly my primary goal.
Yeah.
Is to be like, kids, sit down, draw your mom a picture, write something that you know how to spell.
Yep.
And then I'll give it to her and show how much I care.
I'll give it to her and I'll take
all the credit.
Exactly. 100%.
Right.
That's how it should be. That's why you're a father. Fantastic. That was actually probably the hardest question of today.
Yeah, good.
Now, the real question is going to be, tell us the 15,000 reasons why somebody's hearing aids aren't working.
Yeah, you know, that's funny that you say it like that, because that when you were introducing the topic, that's exactly my
You're like, how do
thought.
I whittle this 15-month topic down to 9 minutes?
Okay, so let me see where I want to start with this.
Yeah, absolutely.
There's a couple reasons why hearing aids.
Choice.
There's a couple things that could cause a hearing aid, quote unquote, not to work.
Okay.
Right? I'm going to try to break it down into three categories. One, the patient's not wearing it.
Okay. Fair. One. Reasonable.
The second
it's
one
not working because it's not in my ears.
Because it ain't there.
Got it.
Yeah, and your drawer does not need help hearing, I assure you.
Fair.
Physical fit.
Okay,
which could also be contributing to why they're not wearing it.
Yep.
Or the prescription.
Got it.
So let's talk about not wearing it. Some patients, because 1 and 2 kind of go hand in hand in some cases. Some patients, if they are averse to having something in their ears, they just won't wear it. The perception of the prescription is a little off of what they feel like it should have been. If expectations weren't set up appropriately, they're just not wearing it. But I'll have patients that come back and go, they're just not working. These things are junk. They've never worked for me from day one. What they don't know is that we can pull data logging on the hearing aids.
And see if they've actually been used?
Yeah.
Wow.
So we can calculate on-off times. We can calculate in what types of environments that they were in. So you can't trick me by taking the hearing aids off the charger and laying them on the table and not putting them in your ears,
the
because
hearing
the
aids
environment never changes.
Are snitches. They're ratting out the patient.
And there ain't no stitches.
You're like, it hasn't worked for 2 weeks. Is that why it hasn't been turned on for 2 weeks?
Yeah.
That makes sense. Yeah.
Perfect sense.
Okay.
So that's just an open conversation and saying, like, look, I know you're saying they're not working, but you're also not wearing them.
Right.
Well, yes, I am. I'm like, well, the data logging of the hearing aid tells me that you've had them on for 1 hour in 6 months. And so that is why they're not working.
Yeah.
You know, the other part of that is patients will say, like, well, I'll be honest, I don't wear them all the time. Or I only wear them when I need them.
Yeah.
Well, you have a hearing loss, and so you need them all the time.
Right.
And so our recommendation is typically all waking hours. You put them on in the morning after you get yourself ready, and you wear them until you're ready to go to bed.
Right. I think that's an important point you make. Your hearing loss is ever present.
It's
it
there
doesn't
all the time.
matter where you're at. It accompanies you. It is you.
And if you're taking them out, putting them in, taking them out, putting them in, your brain has to relearn how to use that signal every single time, right? It's not like glasses. Oftentimes they're compared to one another. Treating your hearing loss, treating your vision issues. They are not the same.
Right.
Okay. And I'm not going to sit here and try to pretend like I know how to treat vision issues. That would be my brother-in-law, an optometrist. But what I do know is how to treat hearing issues. And if you are putting them in for an hour and taking them out for 4 hours and putting them in for an hour and a half because you went to dinner and taking them out. They're never going to work for you because your brain is trying to figure out how to re-regulate.
Stop, start.
They're trying to figure out how to re-regulate to this prescriptive sound coming into the ears. And so that can contribute to a patient not wanting to wear them.
Got it.
So first of all, wear your hearing aids. If the fit is not correct, meaning they're feeding back, they're whistling, you can't get them in your ears, they're slipping out when you are trying to wear them, you need to take that up with your audiologist because that's a coupling issue, that's a fit issue, and we need to make sure that they're going to stay in your ears. I've got patients say, I'm so scared to wear them out of my house because I don't want to lose them. Yeah, well, if you bought an expensive pair of tennis shoes and then you left them at your house while you walked around barefoot, everybody would go like, well, put your shoes on, right?
And your hearing aid should not be the impetus for you to become an agoraphobe. Also, that's not a cool side effect.
It's not.
Yeah.
It's not a good thing.
It's not a good thing.
So we want you to feel confident wearing your hearing aids, confident that they're fitting correctly and that they're going to be comfortable.
Right.
And then the third thing is the prescription has to be right. It has to be right for the patient, right? We use verification. Audiologists who use best practices use speech mapping or real ear measures, meaning they are testing the sound pressure levels of the prescription while it's on the patient's ear.
Got it.
Meaning you and I could have the exact same hearing loss. I'm 6'2" on a good day, you're 6'7" on every day.
Yep.
And so our anatomy is different. So if we have the exact same hearing loss, right, our ear anatomy is going to be different.
Right.
So if we have the same hearing aids, same hearing loss, same prescription, put it in your ears and my ears, the prescription is going to be transferred to your auditory system differently than it would be mine.
Right.
So we speech map and we test the verification of the prescription on the patient's ears so we know that the prescription is being upheld to where it's supposed to be. Now, every patient can't stand or can't tolerate that entire prescription right out of the gate.
Right.
So we have to be very diligent. You've heard me talk about art and science. This is now the art of it. We have to be diligent to work with that patient and go like, this is an acceptable sound quality. I could wear this all waking hours.
Got it.
Great. I'm going to follow up with you in 6 weeks, making sure that you are doing that.
Yep.
And if you are, then we're going to slowly move you up into that prescription. I need to know that you're doing what you're supposed to do so that I can do what I'm supposed to do.
And of course, I think everybody listening understands that makes total sense. It is something that is new. It is something that is different. It is something that we are retraining the brain with.
Yeah.
And because of that, it is not just and now you're good. Like everything's great. It is a longer process than most would like, but it's an understandable process to make sure that you are acquiescing to it appropriately so that you can wear them forever and just have it be no different than putting a shirt on.
Yeah, exactly. We have to keep in mind that for most hearing losses, sensory neural hearing losses, this is a sensory deficit. So we are reteaching the brain how to use a sense differently. That is not typically a quick thing. If you're going to go get a knee replacement and then you're not going to follow up for physical therapy, getting used to that knee replacement is going to be much more difficult.
Absolutely.
Right? And so we've got to be able to realize that this is not a short-term process. This is something that we're going to do for the next couple months. We might get used to the hearing aids really quickly, but there are going to be nuances of treating your hearing loss that are going to pop up, and you got to have a good relationship with your audiologist.
Tell the quick story about what happened when a patient went to a porta potty. And it was a quick reason and a quick diagnosis as to why their hearing aids weren't working.
So this was a patient that we were working with that was, he was an adult and he was in a care home and he had a caregiver with him, and he decided he didn't want to wear his hearing aids. And so he threw him in the porta potty. And so I didn't realize that that's what was happening until the caregiver brought me a blue hearing aid. Yeah. I was like, what?
This was originally gray.
Yeah. Like I was like, was it, this is a skin tone color hearing aid that is now dyed blue. Like, did we color it or what happened? She was like, no, porta potty. And I said, girlfriend, I'm an audiologist and I love hearing and hearing aids. That thing would have been gone. That
was the easiest diagnosis Dr. Michael ever had as to why your hearing aid was not working.
Yeah, it was
a bad color of blue.
Yeah, it was a bad, not the right color.
It was
of blue.
A human color of blue. If you catch my drift. Well, remember to not only be a good child on the heels of Mother's Day, but also don't throw your hearing aids
in the porta-john.
Yep. I think that's easy. But also be sure to remember to share Ask an Audiologist podcasts with everybody, including your mother. And you can help them because they can then troubleshoot their hearing aid issues by listening to this exact episode.
Yep.
Magnificent job as always.
Hey,
Dr.
thanks.
Michael.
For Better Hearing and Speech Month, share it around.
That's right. Remember, Better Hearing and Speech Month. Be a good person. Get it all tested. We'll see you guys next week.
See ya.
You can find more information at askanaudiologist.com, and you can follow us on all our social channels at Ask an Audiologist. The information provided on this podcast is for educational and entertainment purposes only, and does not substitute for professional medical advice.
Why is the irrigator such a necessity in today's world?
It's so much easier. It's easier on the patient. It's easier on us. It's more comfortable.
Okay.
You can do it faster. You can do it it's more pleasant.
Sure.
Some of our patients are like, it's like the ear spa.
I was going to say that does like have this spa quality to it.